Hello, this is Sherman Kaplitz. I'm doing prompt number 2. And the practice of herbalism seems to rely mostly upon anecdotal evidence as mostly uncertified quote-unquote herbalists um, make claims about herbal remedies. Instead of relying upon concise clinical trials or well-conducted ones, as well as in vitro and in vivo research considering the effects of these remedies and as well as the effects of their active agents, um, they seem to just use past experience as their benchmark um, based on prior practice. And again, unlike the AMA, which has very strict certification rules and regulations for people applying to be physicians or other healthcare providers, um, the the Herbalist Society, um, what was only founded recently and seems not to have a central, how should I say it, doctrine or as well recognized certification association. Um, and essentially, in the conventional medical pharmaceutical complex, which relies more or less on peer-reviewed data, extensive clinical trials, as well as investigation of drugs on all levels, including in vitro, in vivo, etc. Um, they really don't regard them as competition, but rather as a danger to potential treatments the patient is on, their faith in the medical system, and essentially more or less a detractor from health. And again, many of these are people, these quote unquote herbalists are not scientists. They do not look for studies into their herbs compounds. In fact, there's a great paucity of research on the medical properties or active compounds of various herbs. There are no standardization requirements or associations which have the authority to say this is correct or that's correct. Many herbal suppliers oftentimes essentially just send out herbs to third parties for analysis, or they don't, but people still buy them. Um, and in certain herbs, such as mahuang, which is where ephedrine was discovered, the amount of these active compounds can vary wildly. If one herbalist recommends a patient take 4 or 5 grams of ephedrine of mahuang tea, they may take just enough to treat their asthma, or they could not, or if they had a really potent batch, um, they may get quite a lot of tachycardia and a very nasty overdose. Um, what else? Furthermore, many herbs such as St. John's wort and others may and kava kava, they tend to interact with the cytochrome P450 complex of enzymes, which is responsible for metabolizing over 60% of all pharmaceutical drugs. St. John's wort, it takes those 60% and speeds up the rate at which they're metabolized, lowering their levels in the bloodstream, whereas others, such as kava kava, may reduce the activity of these enzymes and thus increase the levels of these drugs in the bloodstream, potentially conflicting with potentially posing a major health risk to humans. Um, Again, these things are many herbal remedies are not assayed for activity on metabolism, and many of whom do not have a very clear, how should I say, body of research regarding active ingredients. And I really don't think they're competitors. I think it's just that the medical community wants clear and concise evidence of what works, and they want that one compound to be at a certain dose they know will be effective and safe in most patients, and they do not want to play games with herbs which contain thousands of different chemicals, each of which may be a pharmaceutical into itself. Um, as thus, they they may promote herbalists may promote these their self prescribed miracle cures, um, uh, as, oh, it does this as it does that, but oftentimes they do not cite trials, or if they do, they cite them incorrectly. Um, and they're not really competitors, given that many people who may use these herbal treatments also may use these services of a physician. However, though, yes. So essentially, the practice of herbalism may detract from public health. Um, it oftentimes just cherry picks certain clinical studies or features of drugs that are used in the pharmaceutical industry as being bad and whatnot, even though it was, you know, well-controlled clinical trials and extensive research which discovered those side effects. Lord only knows um, how many side effects kava kava could have. We still don't know about kratom, and many other herbal, backyard herbal remedies are not well researched um, in terms of toxicity or anything beyond the quote unquote anecdotal. As thus, um, it's not they're not so much competitors as they we don't medicine doesn't view them as competitors. It views them as frauds who essentially employ fallacious arguments um, to try to persuade people to potentially take treatments which are contraindicatory and may interfere with whatever therapy they're currently on. And as thus, um, I believe that this practice should be regarded with extreme caution by the general public and should be eschewed by those who are on multiple pharmaceutical regimens.